Haku, everyone. Happy Monday. It is the 26th of April. We have our usual lineup today, Premier Savikataaq, Minister Kusugak, and then our CPHO, Dr. Patterson. Then we'll get into questions, one question, one follow-up. Yeah, I think that's it. Thanks.
Ulasaku naggadjaw April 26th, day marcha na ulang ang mayo ulasa. Sibulik tiyo kalimalaulo ni Minister Kusugak maluluta Patterson aperso hatta sitakwe.
Ublatsana numun mute. Ublumi tak takwa numun nang yo aktu nubu iluan ni nutango yu 9 nguyu ublumi. Matau takwa 9 nuban nang yo akawon ni tabani nubu iluan ni 47 nguyu tabani nubu iluan ni katiluk talawi nuban nang yo aktu 42 yakalung ni pingahot Kinngait ni amamago kangestanami amatakwa nuban lang yo akaron ni tu nunubu iluani 13 takwa aneng inaktu hungitun ublumi mitikid lugo takwa nuban lang yo atare kuti mekapayo himayut 15,163 amatugliani kapayo kanak himayu nunubun miutat 12,181 Takwa an tailiti chi kun piliri bat na wa taka piliri rangin na matata kwa kanigi tuni ubale waktu ayo ni nuban na ya hak tu makawi hai na ho mata amata na Friday mi ama hanan na uti lugu piliri ranga la mata mat na kemat sema paka kawi mga mata kwa piliri ra sutit dua ber sutit takwa piliri la mata mat na pait la tama pimat na pa hi piliri rangin na kapi Makawi ma yung pilere yo akti akho suti nubu miuni kayo wa suti pilere tarape tai ko nubu miu mat na wa paka tai ko kapayo himalak tu nuban na ra tare kutimi ta na kaput atud laring man ta na nuban na yo nubu ilo ne unatang na man mahala ginarap ti ta na nuban na yo kapayo himan ila kapayo taluti nuban na ra tare kutin kapayo himang inarawi huli o kalulawit anya ringmud kapiyo gwang naralutit ta kapiyo himaluk ta lerupta ta kwa kapiyo ni ayok tu aglad ikayok taw niya mata kapiyo himaluk ta lerupta ta kwa nubun narata re kuti mekapumi ama hiwulla pa mi kapiyo himawit kapiyo kanara khalara bituglia ni kapiyo yakta ma potit ta kwa kapiyo himalarawi makuralutit ta na pigunia ikayong niya 94% mo tikin niya matata ta na nuban narata re kuti Moderna nunu miutidiok tu charlo papikapiyo kutluti amma ai himakayo nerowit aniktay lulutit takwa nala charna putit kawi haktaw nerowit ubaluba yakalung nilaw nerowit April 7 ungatani nunaling no aid nerowit ublu 14 aniktay liga kakawit takwa nala chalaw labut takwa aniktay lin nerowit aniktay lutit nakitara kakawit ikayok tawa kakawit ilang nit pekan nang tilihi lutit ikayok taw na puti kihani an tailiga kakabe ublu 14 mata na kingun lakpami okay na hokta aniga nunabu minuta luktanut aniga rovit kinapak himalutit aggawot ang mitsak talugit takwa kanigi luak tangin luta awinili itigay 6 feet ungahik tigi luta ublaluk tangin luta ay himalutit amakapiyaw lutit tunod na rata ray kutimit mat na kimat siya makapung nunabumin taluktan nalat siya sa makawayaw gama uwap tinit takanap tinit ilap tinit nagligayap tinit menerit charlugit ikayut charlugit pinapugot mat na. Good morning. Today we are reporting 9 new cases and 9 recoveries of COVID-19 in Nunavut. There are 47 active cases in the territory, 42 in Iqaluit, 3 in Kinngait, and 2 in Rankin Inlet. There has also been 13 recoveries to date since the outbreak began. To date, 15,163 Nunavut have received their first dose of the Moderna vaccine, and 12,181 have received the second dose and are fully protected with the vaccination. I want to thank the public health team who worked so hard this weekend to continue contact tracing, testing, and helping to adapt to this outbreak. Your work is valued and appreciated, and I want to personally thank you for all what you do, and we all know how hard you've been working and how hard you will continue to work. And thank you to all Nunavut Mute who have been vaccinated so far. And for anyone who has not yet been vaccinated, there's still time. Call your local health center to book an appointment. Getting the vaccine is safe, fast, and our best defense against COVID-19. Let's all do our part and get vaccinated. And if you receive your first dose, please go get your second vaccination shot. If you've been asked to isolate, either through contact tracing or because you've traveled out of Iqaluit, please stay home and take this seriously. It is absolutely necessary that you do it. It's your responsibility to do this for your community. And you need to, if you need help or support, ask your friends, family, and staff who check in on you. But please stay home. Do not have visitors. Do not go visiting. Do not take the risk. As always, I'll end this with mask up, wash your hands, keep at least 6 feet distance from others when you're outside, stay home as much as possible, and get vaccinated. Take care, stay safe, and thank you for all Nunavut Mute for adhering to the Public Health Office orders that are out there. Thank you.
Morning.
Ublakuli. Ublakut. Tunabumil. Ublumi. Ukausari malo tagalitam na take wakawi saktoro tut. Kanyak sinang may nuwag doang na nakaktaw titil dimi utaw tildigu miksano ukausakaw malo aktunga. Nalo na siya mablungalo. Kaya ko nga kanyang sinang tingmiso, kaudlak si malak tildugo kisiyani, kangatalak tildugo tingmiso, nalo na ililaw mo, kaya ko tamaan na kaway saktaw yun, kanita kalaw kayang narayang ini, type ko nga kanyang sinang nalo na iktolok duni. Kanyang sinang mo, tikito ang mata, type ko kaway saktaw tut, ilagay tinut, nalo na iktaw blutik, anyawing mudlo, kaway saktaw yakto sikaw tigilaw mata. Amma inutubing waktu kau tigilaw klutik. Teko tu sang yasang nak tutigu tu sang nak silaw ming mat teko imaka kau yang matak klutik kan yak sanang mo lalaw ningin taman na suling ito. Nalunay di salaw tu kan yak sanang may lak tilugi kisiyani. Amma pilari yigi yabu tama tuminga pilari akalaw tu upalok klutik ko yagi babut ko yan na may. Nalunang itong ilano na bumi isumarong na takadlata mata tumamiksano siya magyak sanginnik siya makoy nangimmat siya makong ikup tigo ilip sitaw nahalagyak to sita makuninga nahalagtaw ko yap tinnik taman na pinaswa ko siyo iluani kaputinod anyakay kutinod kapiyaw na umamat man natagba kapiyaw yakto si mangikubit nuwagduang niyo miksano kapiyaw yakto kaya kabit taman na COVID-19 pingwangong ito arungman. Kapiyaw si mangikubi, kapiyaw yakto. Silak duang me, Canada mi utaw katibudlo. Akso tu tayo makapiyaw yung mga narmini utak kayud. Kaputinig amigak sakto. Silak duang mi utaw katibud. Ubagudli, kaputinig amigak sangyo yaktugud. Anyawik putamang kaputinig atuin naktakatang mata. Kapiyaw yakto ritsitok. Ataw serduti kapiyaw si malarobit. Puigok si mannerowi kapiyaw yakto ya kakandang narnik kapiyaw yakto et ikayok tigig do takisiani taman na salagi yun nang nerap tigud. I think I'd like to start today with a clarification. The individuals who tested positive on Friday night in Rankin Inlet were not even identified as contacts until after their flight had departed Iqaluit. There is no truth to the rumors that these people left Iqaluit waiting for their COVID test results. It is because of the fast and effective contact tracing system and our dedicated public health teams that this case was isolated, tested, and confirmed so quickly. and they are now isolating. Thanks again to everyone involved. So while I know people in communities are scared and concerned, please remember that procedures and public health measures are in place to protect all of us. And this means you need to follow them too. This week is National Immunization Week, and there's no time like the present to make an appointment to get your vaccine. If you want to do something to help fight against COVID-19 in Nunavut, get vaccinated and follow the public health measures. And if you've been vaccinated once and been forgetting to go for your second one, please make an appointment and an effort to get your second vaccine. We all have to do our part if we want to win this. Thank you and have a good day.
Good morning. A lot has happened since our last update. On Friday, we issued an exposure notice for Canadian North Flight 239 from Iqaluit to Rankin. I know many communities are worried about the other passengers who traveled on to other communities, and I would like to remind everyone that there has not been a confirmed case of transmission on domestic flight in Canada. Please remember, anyone leaving Iqaluit or Kinngait must isolate at their destination, as this reduces the risk of transmission in the community. Over the weekend, we issued a testing notice for anyone who was at the Chart Room Lounge on April 14th. Anyone who was there on that day, whether customers or staff, should call the COVID hotline to schedule testing. We took this step because our contact tracing and testing has identified a higher risk of exposure from that location on that day. It accounts for approximately 20% of current Iqaluit COVID-19 cases.
Ola sakut amisune hanuiliortu haulu yassimayo kigullapaami tusarsaulaugattani tallemermi tallermiu tillugu saqhirtitsilortugu katisituinarialiminerne qauyikkauttimik Canadian North kuqangatayuungani 239 iqalunnikkangersinermut yalunaimut Edmonton mullu qauyimagaluartunga amisununali isumaaluutaqangata assinginnik yamalaortuni taakkunani assinginni nunalinni kisaani qaititsigiarumayunga nalunaertoyoqalausmangimma searmartoqalausmaninganik qangatayuuni tabbanik tamaani kanatami iqqaamaneaqqusikina tuinnaaularneartu iqalunni kingaarnilluunniit anittaileqattariali tikittami nunangannu tamannulureanartumi tailititsinersaagunnarnga searmartissigunnaanermu assinginnu nunalinnu pinasaarusiunungaani saqqirtissilauattaqauyisartaugiartuqujilluta kinatuinnartaikani chart room imerbinganiilortumi April 14 utillugu kinatuinnataikaniilortu taikani ullungani taikunga imeriartorsimayu ubbalu iqqanaajartingit uqaalagialiit nuvadjuarnartulerinermu uqaalavinganut initsaliorlu taqauyisartaunermu taimailaqilaortugu taakkua katiyaminiujuni qauyisartilluta ammalu qauyisartaulaortillugi nalunaartaulaorngata ulureanartumi innersaugunnarningani searmarpiugunnanermu taikani ullungani taakkua 20% tirujung maannau yeqaluni nuvadjuanartaarsimayu taikangan.
This weekend, we also confirmed that the B117 variant accounts for some cases in the city, and that this strain is circulating in Iqaluit. This variant may spread more easily than the original strain of the virus, and that increased rate of transmission makes it even more important that people follow the current public health measures. Fortunately, our current restrictions are enough to control the spread of the variant if people take the restrictions seriously. Current research shows that the Moderna vaccine is effective against this variant, so I urge people to continue making appointments and getting their vaccines. It is our best defense against COVID-19.
Tabane pinasaarusiunungaani nalunaersilortugun taanna nuvadjuaner-19 asitsipalliayok B117 ilanginni tamaani nunalipauyanniilertuq ammalu tamannassiarma palliassoriyoyu iqalunni taanna asitsipalliayok nuvadjuarnaq siarmassaqainersaugunnartuq taatsumiinga nuvadjuarnarmik sivulliulaortumik Takua siamat sauti namning anu taima pimmariunex pangulek kikkulimaan maligiaharningin no anneaharnangittulerin malittaa hujaussimajuni. Kisääneli tussaruminartu maannao jesulittarberhartit sinivu takua aulat sitsiarutaujunnaangata siammartailit sinermitaatsumingan nuvadjuanarmik takua malittautsiatuaqqatakisiani. Raajisarutiu sakkerutausimaju taanna Moderna kapuutiu jortaatsumunga nuvadjuanarmu asijipalliajuma atuutiqarunnartoq taimaimaas ajaurtuigaaqunga kikkulimaanik taima initsaliorpallianginnahattaqullugi kapijaugumalutik taanna sapummijauгutiutsiarnerpaangunnanga nuvadjuanaq 19 mu.
I want to clarify the travel restrictions for Iqaluit. While we have taken steps to ensure that supply lines and critical travel are not interrupted and made it possible for people to get to their home communities, all intra-territorial, non-essential travel in and out of Iqaluit is prohibited or restricted with few exceptions. If you are not a medical traveler, an essential worker, or returning to the community you live in, you should not be traveling and could be fined under the orders if you do. Most of those who are permitted to travel out of Iqaluit under the exemption categories I mentioned must isolate upon arrival at their final destination. Failure to isolate can also result in fines. Critical workers must isolate as outlined in their work agreements. That means wearing a mask at all times outside where they are staying. They are only permitted to go to work and back home. And if they cannot find someone to get groceries for them, they can shop once per week during the 14-day period of isolation.
Tukisinartitsigiarumayunga taakua tikibiugunnarninganu aullarbiugunnarninganullu Iqaluit. Taakua qanuiliuqutaharpalliarsimagaluartillu tatamakkua nirhigalai tiki pirutiillu tikigiali tamakkualu tikigiaqallarittu abbiartauqunagit ilainnanginnu taakkualu angeqqaqattarunnaqullugi nunalimminut taakua nunapulimaami pimmariungittuni aullarniuqattartut Iqalunnik ammalu tikinniuqattartut isuluttarbihartitauniartut ilanginnu aaggaugalua annaarbilearluti aullartiungikkuvit ubbaluni iqqanaayaraangugiaqallarittuni iqqanaayaraangikkuvit ubbaluni uteqqalliaguvi nunassinnut nunaligiyatsinnut aullariaqangittutit ammalu akiliititaugunnartuti taakkuninga malitsiarningikkuvi malittaugialinni taakkua amisuunersai aullarunnartut Iqalunnik taakkua malittaulutik nalunaartaussima joqausseriqataartakka anitteiligaaharayartut tikituarutik upattanginnu nunalinnu anitteilinngikkuti taakkua akiliititaugunnarmiyum malitsiaanginnermun iqqanaayariaqallaritti iqqanaayariaqpalliaju taakkua anitteiligaaharayartut nalunaayartaussimayuni iqqanaayartitaunermu angirutingitni tamanna tukilik matuarsimainnaqattarluti aniniatuaraigutik ammalu iqqanaayariaqattuinnarlutik ammalu angeqqamu utitsautigeqattarlutik niuveriartissigunnangikkutik niritaarigialinginnik ataussia pinasuarussu iluani niuveriaqattarunnartu taakkuninga 14 udluni anitteilititauninginni.
If you have symptoms, call the COVID hotline for testing. This is vital. People should not be going out or going to work if they are sick. Symptoms are not always severe. They can be as minor as a sore throat, runny nose, loss of appetite, muscle aches, feeling tired, or an upset stomach. More severe symptoms can include loss of taste and smell and fever. If you feel ill, call the health center or the COVID hotline. Transmission can also occur before symptoms appear. So if you don't identify and get tested, there is a chance more people can become ill. We must work together on this. If you're sick, it's not your fault. If you passed it on, it's not your fault. The virus is invisible and there is no way of knowing you were exposed to it until you develop symptoms, which can be as long as 14 days from exposure. This is not about blame, it's about protecting our loved ones. Finally, a reminder that masks are mandatory in Rankin Inlet and Iqaluit, and that includes while people are in cabs. And cabs cannot be shared by people from multiple households. Thank you.
Kano igu te hatua o vi hani manne o vi te mau khala gun naktu ni wadja na mau khala vi gun naktu mau kau isak tau gun mande lutin. Taman na pimmari o yo. Kikutu inait anige hangit sertu ikana yere hangit sertu hani matua rutin. Tako hano igu tau yo te mai pividjo angin nalo hatangin mata. So le mai tu ina unangata iya lulutik kakili hatta lutik kayung irumnir lutik sanner tu ya lutik takamayu ya lutik balunango le hatta lutik tako pinak sa gutaw gunakto khanim magutaw gunakto so lo mamaksa gunir lutik amalunay gunay lutik amalo utang nas hatta lutik khanim magubit anabi sino khala lo sino na sino balo khala lo sitat sumo novadjo anak to le mo nga situmaki khangit mo khala biyo mo Ser mataugun na nga taman na kano iguti kalaw Iqaluit tilugin. Tay may manalo na simang ito ako bit ang malukaw isak taong ito ako bit ay mamisunak sa kanin maguti kakaw na nga ta. Piliri katigituit na ugahak tuguta matumunga. Kanin magubit immedite may tingit tutin. Ser masin nirubit immedite may tingit tutin pasiyaw dyan itutin. Tana novadjo ang natakot sa ngimat ang malukaw ay manang ngimat katiyakat tumini yung mga apik kano iguti kalilaw nginang ni ang maluilan ni kutay ko ulo ni 14 ni tayo mga siya mabimini ulo ni kano iguti kakpali agong naksitay nakatangata taman napasit siniyo gaswang ito kisya ni sa pudjis si magaswang ni yung naligiyat sini kingulak pa may kahit isibo nga tayo masago bahang ito ko matuwak si may nakatagay li tamani kanyas sinagmi ikalon nilo ilagi yaw lo titay ko pilo at tumi taxi mi ito taxi katam na ito at inutu katagay ham na ito amalo ilumeo katiging ita minay kima katagay hadyang ito o yan na may
Ken Driscoll, APTN National News. Dr. Patterson, you mentioned the variant B117. Just from a quick Google while I was standing here, that's the UK variant as far as I can tell, and they say that that variant has a 35% higher death rate. I'm wondering, what can you tell us about the B117 variant and how prevalent is it as a percentage of the total cases?
Kentos ko ipiteng kumnitano hakaw gabi B117 kakisaya ko hinisakata ang autan nagutawang akwin no nangan ni nga tuminaw o kalimakata suni 35% tingi to hugutagun naktutat sumunga kano kaw sariga kan na nakyutan na numadjoan na B117 kano tigilo tamani no navumiti gibam malokat 6% tingi tako numadjoan naktas mayo tayo may ito haka.
Thanks. Right now, it's just to be clear, we don't have all the samples that have been sent out back at the moment, but of those samples that have come back, it is the only variant that's been identified.
Kaya na may mana yo tayo ko ito kisinangin masuli ang maluilo na tiawlak titaw si mayo ikaw isak tayo yut sa ikalo na ano suli utak si mangin mata kasi anita ko utak si mayo no tahan na nalo na tayo si mayo tuwa tayo may tuning ini.
Dr. Patterson, when you say it's the only variant that's been identified, does that mean it's the only COVID that's been identified in the territory, or are you finding cases of regular COVID and then B117?
Dr. Patterson, tahan na tayo may tutuwa tako ano ba dyan actually tayo may tumit nunavumi ubalo asing ini no ba dyan akto tayo nasibudlo lang tumipita kariba ubalo tako ilo na B117 ngunit aktoyo.
Right now, it's the only one that's been, only variant or strain that's been definitively identified in Iqaluit.
Dana to nalo na tayo si mayo tayo may tu no ba dyan nasi jipalya tamani kalon ni.
Jackie McKay, CBC News. What does knowing the variant tell you about how COVID entered the territory?
Jackie McKay, CBC kunitana asiji palya no ba dyan na kano tukisinak pala ko tao ba no ba dyan na kano tikin ng mga ano na bumo.
It doesn't help very much, to be honest.
Ikayong nakaluangit to taman na tukisi pala ko taham na mo.
Right now, we're looking at a number of possible routes. As of the weekend, there's 3 or 4 ways that or possible routes that it came into the territory. We've not been able to figure out exactly which one it is or if there was more than one. But we do know that it was COVID was definitely circulating in the city of Iqaluit before April 10th.
April 10.
Mm.
Yadjiging ito ni tayo may tuhatuin na kaya lakano tikin ng mga taman nuwat joang na ako pinasa ako si unong ni pingas unong balo si taman tayo mga kano Nunavut mo tikituin na kaham ng mga isumagayaw sa mayo. Sulinalo na ito sa malaking ito walo analangon ng mga obalo nalati ko tako nung sa maktaw ng mga kasi ani kawin ak sa mayo nuwat joang na 19 ikalun nilang na kaya nga April 10 tungani.
Considering that so many cases are linked to bars in town, are you considering testing cab drivers and their staff for COVID?
Sa magilugo tamak ko ilo natigala emir bin ni sa mabiyo yung minuni nga ni sa mas mabita ko at haksak ti ako tingi kanayak tingi lo kayo saktaw ng mga ta.
We're in the process of offering surveillance or screening testing to a number of groups in the city, and cab drivers are one of them.
Kayo isa masaksiyo ko takapalaya ko kayo sam na madjiging ito ni solo at jiging ito ni pila katigi ni tako ilagi ya luti haksak ti ako ti.
Matsi Savi, Radio Canada. Just to clarify what you answered to Ken earlier, is there one person with a variant, or are there multiple people with the same variant?
Matsi Savi, Radio Canada. Kung ito kasi naktisigyaw na kaya daw si ito mga tat sumuha sa jipalaya manuvat dyan naktak sa mayo balo amisod.
So as of Friday, we had 21 genotyping results come back. All 21 of them have the B117 variant.
Talle me monula to tako 21 utik si mayo kallo na ni kaya sakta minyo ilo na 21 tako B117 nguna kaktaw.
And how many more people have been identified as contacts?
Katsikan ni katiya hapto minyo ning inalo na taw si maba.
We're just trying to remember the exact number. There's up over a couple hundred now in the higher risk contact group, I believe. And there's been, as of yesterday, a little over 800 people who have contacted the hotline and are they're being investigated after the last week or so. Sorry, since this all started 2 weeks ago.
200 ang tani ito tayo maulo ka naktumin naksaulo ti katiya hapto minyo nakatayo. Amaloy pat sa munod 800 ngoyo tako ukala katak si mayo tat sumunga ukala view yumut amalo katiyaw yuminang nakawiyaw si matuin na kailin. Tamakwa kawiya saktaw valya ni akto tayo makupin sa ako si taman na pigyali lang ngani.
To enter the Canadian press. You said in response to Jackie's question that COVID has been circulating before April 10th. How do you know that, and how far back does it go?
I'm trying to kakawgawi taman na nuwad dyan na tikit tuminyo na asugod April 10 gulaw ngini nga ni kano taman na kawiya magaview.
We're confident that it was here before the 10th because we know of some people who were symptomatic before then and had not traveled and have since tested positive for COVID-19. But we're at this point we can't go back or can't reliably go back further than that.
Nalungit to tamak ko April 10 tamani tungani tikit tuminuningin no tako ilangit kano igo ta hakpalali law ngata April 10 go law tinago awla law simagatillo ammalo nalo na taw sima law to tinovat juana ta tuminuningin ni tamani manno yo tako uta kanalo te April 10 tungani how yinang ito.
You said one of the groups you're testing are cab drivers. What other groups are you testing in Iqaluit?
Ukakaw bita ko adjiging ito kanayat ti kaya saktaw na nakasuwiso lo taxi ti kikullo kano ito ilo kaya saktaw na ka.
We've had some screening testing at the men's shelters, we will be setting up screening testing for the Elders Center, for staff at the boarding home, the hospital, and some corrections facilities as well.
Haisaktaw nato ila haisaktaw yo hasimayute kani angutino ang kahangit kubimi malupam na simayugo tamakoy na kubini haisaktaw na ningin kanayak tingilo ana binni amaloy kayaktaw bimmi tuni.
Justin Matarna, that's Yak News. Can you walk us through the timeline for Flight 239?
Justin Matarna na siya kung ninalo na yak ako tayo nakangatayo 239 kanil latangong ng mga.
What do you mean?
In terms of, so the flight was at 5 o'clock on Friday, the notice went out on Saturday morning, and by Saturday afternoon we had 2 cases in Rankin. So when did you find out that there was those 2 passengers and kind of how that process happened?
You answered your own question. Talimig me tema aulalaw to find me. Hayaw takho natsi ngayalang na mi ulasak ko nalo na ito takho natsi ngayalang na mi unusak ko takho nalo na yare kaniki.
So we got notification about some positive results on Friday evening, right around 5 o'clock, end of business. And those were passed on to the contact tracing team who started calling the individuals and explaining what had happened and starting the contact tracing around them. One of those individuals identified their contacts and said, these 2 people are on the plane to Rankin Inlet, and they immediately called me. At that point, the plane had either landed or was just about to land. With support of some family members and staff from a few communities, we found out where they were intending to stay in Rankin Inlet, located them there, and they were transferred to the health center where they were tested Friday night. And so by midnight Friday, we knew they were positive and they were in isolation.
Ikataw law tugot tako nalo na tayo miniuningan itala mi utilogo nokko faimi ikanayak na ni tilogot hana ikataw sit sauti itako te ko kati yamini uyuni sakti okala sit sauti yamini nalo na yailu ti kanui to hakti mini mga tako lo kati yamini ni sakpala sit sauti gilutik tana ipangahanga tayo milaw to tako makpuna luna ito lo to kanya sinang mo pala tilo yakila miyo tan hawi kapta choti yemi tako naluna ito simaninganik tan milaw tindagulo ni hanga tayo kanya sinang mo balon ni minniw salak tilogo tako ikayok tawlo ti asingin ni nunalin ni namin nam hati kanya sinang mi tako hawi yawlak timini nani yawlo tilo ana bila huyawlo ti talle mi unnukko unno akullo naluna tawlak to minulu tinuwad jo anak to hamning inni anik tayle ko jawlak to tillo.
I know that you said that the risk to other passengers on that flight was low, but has Canadian North shared that passenger manifest with you, and are there any plans to follow up with other passengers?
Ulo anak to mingin na kaya titako iki makati miningi Canadian North kunni tako tunisisima wa Canadian North ko kikko iki mayo minisima mga tatay kani hanga tayomi.
Yes, Canadian North has shared the flight manifest with us, and especially the people sitting closer to the infected individuals have already been contacted.
In Canadian North ko tako nga tunisisima kikko iki mayo mini mga tako hanik sak nasa mini yo hanga tayomi how ikataw simalakto how isaktaw simalakto tillo.
Trevor Wright, Nunavut News. You mentioned that there are 3-4 possible routes of which it may have been introduced into the territory, I believe. Could you go over how it may have been introduced into Nunavut?
Travel right Nunavut news kung nakakauga pinga sui balusita matigutan na tikito na kaya hapto minuning ano Nuvadyanak 19 mo ukaw sa kakong nakay naltag ko nga tamang tikito tayo tuwin na kaya ham ng mga.
I can't right now. A lot of it's speculation, yeah, when we get more certain or as close as we can, we'll talk about it at that time.
Mana yo haon nang ito nga taman na nalaut sa tuwin na atigo tukisiyak kat na ukta nalunaya akong naksilak takalo mo.
You mentioned the chart room accounts for roughly 20% of cases in Iqaluit. How much of that came from April 14th? I understand that's a karaoke night at the chart room.
Ukakawagawita ko 20% ting itay ka ni chart room may mabimi sa magbiw na kasugi tamani kalun ni tay ka ni April 19 o tilugo tay ka ni lo ingisung mata ingirong naksugi ano taman nato kisinaktigya.
Right now, it appears that that one night at the chart room accounts for 20% of or just over 20% of the positive cases in Iqaluit.
Mana yu tay ka ni ataw sa miunungan ita ko 20% ting itay ka ni sa magbiminiyo lalo na ataw sa mayunuwad yo anak to kamningin.
Ken Driscoll, APTN National News. Dr. Patterson, months ago we heard about a pilot program for testing at the medical travel hubs. Is that program still ongoing, and does it extend to the expedited medical travel program?
Ken Driscoll, APTN ko niluta Patterson takigalaw lo tinukaw sa kalaw kabi uturaw taw yo hamningan ni kawi saktaw katak ningin ni tay kanana bila tuminang no anit tay libyo yo ni kanlunani takot taw kilamiyo yo kana bila patutiri katak to kawi saktaw katak iba.
Yeah, it's available in all the hubs, the testing program, and it has been offered to expedited medical travel individuals, but until COVID-19 was in Iqaluit and Kinngait, testing people who are going down on expedited medical travel isolation isn't something I would have strongly recommended or would have recommended because the usefulness is low and it's much more likely to have false positives like we saw a couple of months ago.
Ita na tuwin na titawin naktutan na kawi saktaw katakor nang nek takunung aloti sa kaya katak tunan na bila tuminak na tuwin na titaw katak mayo taman na tikilawin nga ni Nuvadyanak 19 ni kalun no kingam nulo kaya mga tuloy ko yung simalawang ikalawak tunga kawi saktaw katak kaya tungin ningin kaya mga tuto kakayang imatay matsay na tama ko taw katak kaya nga ta Nuvadyanak tax si manirak taw luti Nuvadyanak tax mangitu galoy.
Dr. Patterson, a few weeks ago when Ontario started to get very elevated numbers, one of the measures they put in was to close playgrounds, which they quickly reversed. Here in Nunavut, we have far fewer cases, both in total and per capita, than Ontario, but our playgrounds are still closed. I'm wondering, what's your reasoning behind closing down public playgrounds?
Dr. Patterson, pinasaw si Galalo to ni Ontario, Miami sulok pala to nang ningin Nuvadyanak tato. Matuyaw lang nga tatako sa kusilano sila miyaning wabin. Nuna bumilihat sinaw na sa tilugin Nuvadyanak ta si mayo tako matuyaw si mamata pingwabi sila mi sumawa.
So there's two things, the rationale for that. One, we're still early into this outbreak, and we do know that outdoor contact is much safer than in-house contact. But because there was a certain amount of uncertainty, we wanted to do everything possible to stop all transmission or limit the chance for transmission to occur. The other thing is that some of the public playgrounds and parks require staff to be there, and it increases the risk for staff because they have to get together and work as part of their effort to support that, especially the parks. So we've left those closed for now.
Ana makulang ayo pidjutingi sule pigiali salo ang taman na sa mapalyan kamalo tamakko at tanang itumin sa kuyiluta ila sila may tilug at tanang itumin sa katakto galo sa mabiyong na ng mo ilo anin kasi anin alunam ni kung ino kano tuwid na nakatit sigumalaw at taman na sa mapalyan yagon nang nin tanat kikutuin nang naping mabiyo sila miyam malumang sabi lugar nak tumigo tagon nang ate kanayak tingin kanayak at gigiyak at tiluwi Ilo akto mi miyang sabi ni tayo may mamana kayo na mo matumayaw ni akto suli.
Jackie McKay, CBC News. Has anybody been hospitalized from this outbreak?
Jackie McKay, CBC kuni anabin no unit to halaw ka taman na sa mapali at ilugo.
Not as of last night.
Ipatsaon no aga.
I'll let you guys decide who is best to answer this question. The Kutak Society is down 3 weekend staff members. They say this is crippling to their operation because the staff members also work for the GN and the GN won't allow them to work in multiple locations during the lockdown. Why can't GN staff members work in multiple locations when they're working from home anyways?
Oko taang yakahangit tuloy kuno takwa pingasoy na ulang ata. Pinasa ako sinong wani kanaya katakong naktot. Tako nung alon nunawaga bumakuin na kanaya tiyo sinang ngata singin na kanaya ko yung ikay nang ngata taman na sumawa.
Thank you. The reason there's less staff there is reduce the risk of transmission, and family services working with Iqaluit Society to resolve the issue. Matnataan na tayo kanip amihungin nakhawlak to pilirayo tayo Iqaluit Society mi takwa ay tuloy lang yung matanuban na jwata ilanuban na jwami takwa inuliri kut pilirayo katigi yaman na takwa Iqaluit kut society nga tan akigyan na yaman.
My next question is for Dr. Patterson. Survey Radio Canada, are you still able to say that there's no community transmission?
Mati Survey Radio Canada kung nesulaw ka kung nakita man nunalin ni mani tuwin na sa mapalangin ni ngani.
Right now, we have one individual that we have not been able to establish the link. That's it.
Manayuta nataw sitwa nalo na yung nasamang itabo nakit sa magbiong ng mga.
You've said in the past that you'd be able to respond to 3 outbreaks in 3 communities, like simultaneously. Where are you at now in terms of medical resources? Do you have enough? Are you deploying more staff in Rankin, Kinngait?
Ukasi magawita ko na ni pingasuni no nalin ni amigasi valala kaya kata taman na pingasuni sa magbiyo kalam nakat. Manalita ko na ben ni pilari ko nakto kanutigi amigasi lo ang ila to palo kanayak titakan nas mabisi kaya sinang mikingam nilo.
Right now, staff is adequate to deal with the situation. If we start to get more communities, it's going to be a stretch, and so the operations team is looking for ways to increase staffing or increase resources that could be deployed if needed.
Manayuta ko na matik kanayak taham ni buta ko kamagunat siya to kasi nasik kanya nga nino nalin na siya makto kalam na kata ko amigasi valala kayak to takwa lo awlat sinang mo kamayuyo kawiga swak to kano kanayak titakan na kung nakayak mga ta awlat itaulo titako no ano nalin.
I'm going to transfer the Canadian Press. What are your recommendations for people who live alone in terms of their bubbles? Are they allowed to have a bubble with another household?
I'm trying to Canadian Press kunita ko le inuto tilugo ilumeo katakang ito asingin ni ilumeo katiging ita meni pula katakakata ko nakat.
Right now, it's not allowed and definitely not recommended. I understand that's a struggle for many of us, but we need to keep the social interactions down to the minimum needed.
Mana yu tayo may hangit amalu taman na tuloy ko yaw si mangito tayo may hangin ni ngani. Ila tuloy ko yaw si mayo tayo may taman na ila ayong naktugalo ami suno kasi ani tamak ko ino katigay kati katam ningin man na isulit tabi hak titaw ga hang ata sa maktay litit sinam.
Can you explain the timeline for the recovered case in Kinngait? There's still 3 active there, but 1 recovered last week.
Nalo na yakon nakhiw tayo nakanoy kun nang nakataw si mayo kingang niya taw si akwalo pingasulak to di tayo nataw si pinasako sa nakanoy kun nilaw to nalo na yakaya kay nako.
So the timeline for taking somebody off of isolation is 10 days from when they became symptomatic, or when the test was positive if they don't have any symptoms. So one individual, it appears that they picked it up, they acquired COVID-19 here in Iqaluit, and then transmitted to the other individual during or after their return back to Kinngait.
Kangako ni miningi takwa solo ani teli titawlak ni miningin no kanoy kun ni ko takatak to ilan ni kulo ni hulinik kanoy ko takapalya sila nga pigyak to o balo ni nalo na tawlaw tilugo kawya sa ko ti miningin tay ma kanoy ko takangit pakisya ni kanoy kun ni nakaktaw hatak to tanay panganawa dyan naktak to miniw walay o tamane kalun ni siya masitak haw tat sa mga tuliano no ba dyan naktak to mo tamane Kingam ni ilak tiluwi balo kingun ni ago kingam no simalak tiluwi tako sa mahataw ti yumini.
Joseph Patterson, NSAC News. 20% of cases came from one night at the chart room. Is that considered a super spreader event? And where did the other 80% come from?
Dastan Patar nunat siya kumnita ko 20% tiyo sa mabiyo nakakaw gawigi chart room imel bingani. Tay kanisa makbilla kaya lo nakataw kung naka ambalota ko alin na misa mabiyo yuminiya singi 80% tingi.
Yeah, it appears that the chart room on the 14th fits the description of a super spreader event. The remainder cases were transmission at other public sites, workplace and household or private get-togethers.
Chart room itay kanay makbingan ni 14 nga ni sa mapalalaki gutaw yuminiw nakaktaw kung nakto tako ali asingin ni sa makbiw si mayo ikanayak bin ni ang ikariyaw yun ni balokik kutuin na yung pakataktanin ni.
On Friday, alongside the chart room in the storehouse, you identified Canadian North as a site or a workplace of potential exposure. Canadian North at the airport, how many cases have stemmed from the airport in general?
Tali na minalo na sila ako bitahan na Canadian North kaya kanayak binga sa makbiw tuin nakahak tuminiw ningin no tayo kaniya kanga tayo ko bimilo kano tigi tayo ko sa makbiw si mayo tabang nga katsiwan.
I'm trying to remember the exact number. I can't. But later in the second half of last week, more than half of the cases were linked with Canadian North.
Ikama ka sa ato gala kasi nakatsilata ang mga takay ikaygon nang ito. Tay kani pinaso ako siulaw to me abangit tay kani sa magbiw to na sa magbiw ning ininalo na taw sa mayo Canadian North kun.
Nunavut News. How much has testing ramped up with the new cases and the new testing center here in town?
Right Nunavut News kun ne kanu tigita ko kaw isak taw kun nakpalak sa mabatay kanya sa ni kaw isak biw law to me.
It's gone up more than tenfold. Probably before April 14th, we were doing in Iqaluit 10 or 20 tests a day, and most days probably more like 10. Now it's well over 100 most days.
Before April what?
14th.
Ako kami sa makapalak sa mayo huli ka makitugit April 14 tungani huli ni abatino kisani to na hayo sa akong nakatalaw to kisani ulo ta mga 100 ng atani to na hayo sa katakaw naksiyo.
For those who, I guess, maybe forgot in the midst of all this news, what are the basic symptoms for COVID-19 that people should watch out for?
Puigok pallai matataka kanu iko takasungin ne kanu nalana yaga kanilaukin.
The symptoms can really vary a lot. Some people don't feel very sick at all. Cough, fever, headache, shortness.
Slow down.
Sorry. Beyond those, cough, fever, shortness of breath, headache, sore throat, being very tired, muscle aches all over, and loss of taste are some of the most commonly reported ones.
Tamakwa kanu iko tau katatu ajigingit sa katatu ilangi kanu ingit sa mga katatu kanu mangi katasutik. Kisane huirso katatu ilangi auter nasi katasutik ipineale katatutik neahungule katasutik iyarlule katasutik nirigo mayatutik tamakwa tagka ilangi kanu iko tau gunnakto.
Kent Driscoll, APTN National News. Dr. Patterson, in response to Matisse's question about what happens if it gets into a few more communities, you said you were looking at resources available from the South. Ontario's jammed as it is and is cancelling elective surgeries. Ontario's asking Atlantic Canada to send nurses to them. I'm wondering where these extra resources are going to come from, considering the rest of the country is facing a significant problem as well.
Hentrisko ipitian kuniluta Patterson o kakaugavi Matisse kiulugutako asingin nunalino taman nasa makan kami gaksila yagatsi Ontario miluteko kami gaksila ilangata tema sa mabiuloan ni kumo piyat sa kaloan ni kumo namalu pilatta gunnak tu pimariung itunik nokaptitaw si malutik Ontario miulala na sirtini tutsirangata singin ni kanatami nakilita emano na buhay kayok titakan ni runaksigayanga.
There's a number of options up to and including requesting assistance from the federal government that the operations team is looking at right now.
Adiging ito ni nalirago te hakto naki tutsirago natin nitin ni solo government hakkum ni kako awlat sinamo pamnayo tamakkuninga khimikoyo.
In addition to just finding nurses, we're also looking at ways of altering workflows so that other staff, and some of this has already happened, so that other healthcare staff can take on some of the work that nurses are doing, like the daily calls or every other day calls to people in isolation. So there's a number of avenues of making the most of the staff that we do have.
Takwalo ana sirti asingin no takwa asingin ni khanili o kasawara hawi sammi yugot surli khana yamningin asijjaqtaw kay nakatalutik tamakko khana yakti yoanna binni anna hannangit tulirinang mo surlo asingin ni anna sirti yung tinokhala katitsinga khatarluta anit daily view yuni khanuiling kalo mangata tamanadi ituk kamagiyaw kunnakto.
I'm not sure if this one's better suited for Dr. Patterson or Minister Kusugak, so you guys can decide. You've been operating these medical travel hubs for a year. As of last week, there was nothing outside in front for children, and children are a significant portion of the people who are going on medical travel. Not a swing set, not a sandbox, nothing, just an empty parking lot. I'm wondering, considering these hubs will be going on for some time, are there any provisions in there to make those stays more bearable for young Nunavumian?
Tanalota Patterson bala Minister Kusugak kiugunnak tanga tamakko anna bila biu batinani daily view yo khalluna na qaguli mame awlata wasmalangata taima sugusem no sukhanile utitsani pitahangit sa ngamalo ami sudluti taiko anna bila hatta sugusela makuttuillo kisani nuna siuti no khanga bitu inna migum naksuti tamanna kunikkan teme na tutsa ma khanile utawna khatamakko piyat sa hakta kan ne gonna hatta khulluge sugusila.
Takua aning wabing ni takuna ni siniktawiyo sila tani napay jang itu taman laro nang itu ni kisene asingin niktaw anilaw pidlatuin nakatang mata Iqaluit ataw sumi anilaw pidlagun naksuti kisene adjiging itu ni kinaktu pilare akakasuk tugulu solo kakayangate iluani kano tipingwe ako nakayako tiksanginik pingwa niglunit titrawayagak sa nigluni makuning adjiging itunik kakaya ilo ni pilare ngoyon naktunik ipingwe yaw tunik tamakuning aman nakimikuyo. Yes, I truly believe we won't be erecting any playground equipment in hotel parking lots. That's not doable. But there's so much more that could be done, and that what we're doing and what we're looking at is doing things to entertain the children when they're in their hotel rooms. Things like coloring books and interactive toys and stuff like that. That's where we would put our energy.
Jackie McKay, CDC. My question is for Dr. Patterson. I'm wondering how much the karaoke played into the spread of COVID at the chart room.
Jackie McKay, CBC, kunitay ka ni chart room, may bimita ko yung ikatatilawin hano tigisa ang mapahalago tao si manaka.
It's certainly a factor, or it's almost certainly a factor. The singing has been associated with other super spreader events. So yeah, that's part of why when we adjusted the orders last week for those restaurants and bars that can open, in addition to reducing the size, we banned karaoke and singing. There were other factors that contributed. People were moving from between tables, and there were certainly tables and groups that were larger than 6 at times. So karaoke was part of it, but not the only part of it.
Itaman na pidyo tao lakit tumini serma paliatit sinamut. Hawi naksima magu ingir to hartilugu tayo ma ingir hatartu ni serma paliatit sigum na nga tayo may mataman na ilagay yaw may masijir tao tilugu tayo ko malit tao gali niribin ni mirbin nilo hatsigum nang ningin ni ingir harum nirtit sila umiyagum. Asingin ni pidyo ta hartu galo akisianit tao tayo ma saging itamin asing kita sangin no hatang nang nga malo 6 ang tayo ni hatartu mini lutis sa mi tuit. Kasi ani taman na ingi hatak titsine ilagayaw medyo serma pala titsine minyo nang mo.
Was the chart room breaking any public health measures at the time of the event? Was the karaoke something allowed under the public health measures?
Dahil kana yung chart room si kumitsin naka dako nga malitaw galin ning.
Karaoke wasn't excluded at that time. As far as other measures, I have only hearsay accounts, so I can't comment.
Kaya kaning hatang ni tema nukhapti tayo sa malawang ito galo atay sumani kisana asingin ni pidyutin ni ukhak si mayo galo asimin ni kisana ukhaw sa rigun ng itangi.
Matsi Savi, Radio Canada. Just to follow up on Ken's question, under which circumstances or which criteria would you have to meet to ask for federal help or help from the Red Cross as you did in RVET?
Mati Sarvi Radio Canada kunik apik tinga apik kan nalugo tayo malihang ako tutsikali kayak ikayok tayo gumalo tiga pa matokak kunni balo Red Cross kunni tayo ma avane ikayok tayo lawas si mamatito.
So those are operational decisions when the operational staff are at their limit or they're no longer able to keep up with the contact tracing. That's when we'd start asking for different forms of assistance. Right now, they're looking to, if they can, increase the staff a little bit so that that there's more leeway if something happens, and also to ensure that there's avenues should we reach that point. Sorry, avenues to get assistance should it reach that point.
Taman na ulat sinamo isi maliw tayo kaya kakayakto tayo kwa ulat sinamo pang nai ulat tayo yunik sulo amiga silo alang nakatangong matigum na ilipatalo katiyaw yuminang nakawi isang nang mutay ma ikayaqtau gumaligayaqtu maana yaqirayaqti taakanne rumayu vitsaugalua taakua asingin hanoila jo hakkadlaarne qa piliriyugunnaqayaqtuni kisaani maana jo tikiutissimangita vuteemaa tutsiraqayaqarne qaakkanningagu ikayutitsan.
Thank you. Are you considering to screen people in our airports?
Isamassimavi qangatayukkubinni qauyissaqattarnermu.
Beyond what's already done, only in terms of screening for symptoms and such, it's only useful if it's part of a, if you're meaning testing, it's only useful if it's part of a larger system and involves repeat testing a week or two later on.
Tema hakkanningagu hanuiliutau hattartua siagu qatsuulu hanuigutiqammanga taqauyisartau qattarneaqqata atuutiqarayartu kisaani qauyisartau qattarlutik ammalu kisaani qauyisartauliqqi qattariaqarayartu ataussipa pinasaaqassamaqqulluunni naassimalertillugu.